and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And here at Gold, we are getting ready for our tongue tie conference of 2024. It's an exciting time. We're deep in the preparations for this conference. And with me here is one of our speakers, Kate Roche. Welcome, Kate.
Hello, thank you for having me. I'm very excited to be here.
It's wonderful to have you here. You have such a great topic, and your topic title is Neuromuscular Re-Education and Tension Release as Tools to Optimize Feeding Post-Frenotomy. Great topic. I want to talk about that in just a moment, but I want to talk first about you. You know, you have a great background. You're a physiotherapist, and together with your husband, you run a national tongue tie center in Ireland. So tell us a little bit how this came to be and your work there.
Okay, so this really started 25 years ago with the birth of our first daughter, and then with our subsequent 5 children, we ended up having lots of issues with tongue tie and feeding, and that really started us on this journey, and it just evolved over the years. We started first of all treating babies. And then we started treating children and adults, and that seeing how tongue tie affected across the lifetime and what we were seeing in the older population really then gave us lots of insights to bring back to the babies, and really seeing how if we don't get those good habits, correct breathing, optimize craniofacial growth, we needed to do all those things as well as address the immediate feeding problems, because we could see how these were impacting across the lifetime. And I suppose the other thing we really found is it's actually becoming more complex. The more we know, the more we realize we don't know. This is such an evolving field. And when everything that we're learning about the nervous system, about sensory integration, all these things, lots of people have issues that they don't even recognize as being related to oral function and posture and all these things. But it's often, if we don't have that core stability, if we don't have that ability to tap into our regulation, it affects so many aspects of people's lives. And, we're very much on a path and learning more all the time. And there's just so much more to do. And it's a really exciting field to be in.
It sounds fantastic, Kate. What I love, you're so passionate about it, and you can hear the passion in your voice. You have done this for such a long time. Tell me, when you started out on this journey, of tongue tie. I mean, tongue tie has been around is as old as humankind, of course. But now we in the recent years we learn more and more about tongue tie. There's more and more research available. But when you started that out, probably people were like looking at you like, what are you doing, right? I mean, just a quick snip and here we go, and the baby is good, and why is there so much to learn? So you probably have seen a lot of that in your
Totally.
field.
And I think, one of the things I've really found is when we look now at our 25-year-old, so we were very lucky in that we were both working on the neonatal unit. A lactation consultant and pediatric surgeon came to us day 5 of life and treated her tongue tie. She continued to breastfeed for a year. And we thought, that's it, all sorted.
Mm-hmm.
However, what we are now seeing, looking at her as an adult, there are still issues there. We are now going back in. We are retreating, because what we thought was dealt and done, because we didn't have all the other tools we have now. We didn't have that neuromuscular education. We didn't go and get tension release. We weren't understanding all the other bits of the jigsaw puzzle. And we're now having to do that all these many years later. And we can really see how we've got to not just look at the here and now. We've got to look at all the systems and look at those long term. So it's and I think as well, people often will say, oh, well, this is something that wasn't around. Another thing I think is very interesting. So obviously this is something that runs in our family, hence we had so many issues. And I know my dad restores old photos, and he was showing us my great-great-grandfather. And of course, there's no talk of any tongue tie in our family. But you look at the photos, you can see the face shape. You can see the smudges under the eyes. You can see the open mouth, low tongue posture. You can see the ear position. Tongue tie was there. There must have been sequelae because of that, but it just wasn't recognized for what it is. So now that we have the education available to us, we really need to embrace it and see how we can improve people's lives for the better.
Absolutely. And I love that you get to see those babies you treated over a lifespan, right? And you're also treating, adults and older children as well. So you get to see a lot of different, ages and stages and see the effect it has and what it influences, right? You mentioned the baby is just not just a tongue, right? We're not just a human and a tongue, and that's all there is, right? But there's so much more to it. And especially you in your position as a physical therapist, tell us a little bit about what you do specifically in that role.
What do I do? So depending on the ages, what I'm really doing is I'm doing a lot of feeding therapy.
Mm-hmm.
So I'm looking at function. So
Right.
when I assess a patient, I'm looking at how they achieve their function. So it's about quality of movement rather than task accomplishment.
Mm.
Often we look at, well, they can do that, so they're fine. But it's how they do it. It's how they move. What's the effort? If someone's having to use compensations, it's very energy efficient.
Right.
Yes, we can teach them to compensate their speech or their eating, but life's so much more difficult. That is going to
Right.
be much
Yes.
harder, and that's going to impact quality of life. I suppose as a physiotherapist, I'm trained to look at everything. So I will see the patient as they will walk into the room.
Mhm.
I will see if they're in-toeing as a result of fixing with their adductors because of their poor core or whatever it is. And it gives me the opportunity to treat
Treat.
them
Yeah.
however. And what's really interesting now as well is we're seeing lots of families. In fact, we have more than one family at the minute where we're actually treating 3 generations.
Oh, that's
So
fantastic.
we have had, they've come with the baby. Then the parents can see the effect on the baby, and then they're saying, and we're saying, well, actually, the tongue should be resting on the roof of the mouth, and the parents are going, well, mine doesn't. So they're realizing, but then also we're talking about sleep quality, etc. And then they're like, but my mum and my
Oh,
dad do
yeah.
that.
Yeah.
We have normalized snoring or whatever it is within our family. And so it's very interesting how that, we've got these skills we can bring, but obviously it's totally different treating a baby to, we have a few patients in their late 60s now and really seeing those benefits. And it's great seeing, how families embrace this wellness approach
Yes.
to improving quality of life.
Life. Absolutely. You mentioned something very important, compensation, right? And this is also what your topic is about. You're talking about neuromuscular re-education and tension release as tools to optimize feeding post frenotomy. And you mentioned something there, compensation, and the bodies are miraculous, really, and babies are super smart, so they find ways to cope with the issues, or some ways, right? And so after the tongue release, we need to work on that because they have developed these kind of strategies for themselves to cope. Now to get back to the normal feeding pattern or normal function as well, right?
Absolutely. So we have to remember they started sucking and swallowing in utero. So those compensations are there before birth. And what we need to do is we need to motivate them to change.
Mhm.
And we need to give them the skills. Um, for example, how they can move the tongue post-frenotomy is different to pre-frenotomy. Those biomechanics have changed. And what we want to do is really take advantage of that change and run with it. So we need to start pre-frenotomy
Right.
because obviously they need those to have those coordination patterns. They need the muscle tone. We can see during surgery which babies have done their pre-therapy because we can see that muscle tone. We can see them taking up the extra movement we're giving them. We can see them utilizing it. We then need to bring that to feeding. We need to make sure we're having that change, especially when we're looking at breastfeeding. We've got to look at teaching them the skills, breaking it down, and ensuring that that feed is different, because what we need them to do is put those vertical forces through the healing tissue many, many times a day. If we
Mhm.
do an exercise program, it's just a few times. We've got to get those habitual changes so that they're doing it all the time. We've then got to make sure we're taking away any blocks, so they mustn't be uncomfortable.
Right.
Discomfort is going to inhibit movement. We need to make sure that we are looking at fatigue, stamina, alignment, all these things that are going to help them tap into intuitive movements, because their learnt patterns are compensatory.
Right.
So we want to guide them to using and tapping into that movement and really taking it on, and not reverting when they get tired. You know,
Yeah.
we also know that during normal healing, we're going to start getting a period of contraction between day 5 and day 7 post-surgery, and we've got to make sure we get through that as well. You know,
Yeah.
that we keep the incentive to use that range of movement, to claim it, make those habitual changes, so that, you know, we get our movements from the automatic part of the brain under conscious control, where we can affect change. We've then got to make it engaging and useful, so that when it goes back into the automatic part of the brain, it's the new movements, it's the new habits.
Right.
Because then once we've got new habits, we've now got a maintenance exercise program for the lifetime.
Fantastic. Okay, thank you so much. That was absolutely wonderful. I already feel like I learned so much just talking to you. And we haven't even watched the presentation yet, or haven't even watched the presentation yet. That's still to come in September, when you are live and part of the conference. Thank you so much for being here with me today.
You're very welcome. Thank you for having me.
And now some information for our viewers. Kate's presentation is, of course, part of our tongue tie conference here at Gold, and we get started in September. We do have for this conference 2 open access keynote presentations available as well. Check those out as well. You'll find all the information at goldtonguetie.com, and please share this information with everyone in the field and your colleagues and friends as well. Thank you everyone for watching, and I hope to see everyone at the conference. Bye-bye.